Most of us have experienced unfamiliar yet special feelings when we first began to explore our bodies during adolescence. This experience is one of the most intimate relationships a person can have with themselves. So, how much do we really know about it? In this video, we will address a topic that is rarely discussed, but that everyone knows something about. Perhaps now is the time to get to know the most intimate relationship you have with yourself a little better. We will explain the most frequently asked questions about masturbation. Is masturbation harmful or beneficial? How often should it be done? Is it addictive? What is the function of orgasm, and are there differences between genders? What are the most common misconceptions about masturbation? We recommend watching this video all the way through, paying close attention to every detail. Let's get started without wasting any time. Masturbation has many more benefits than you might think. It boosts your mood, reduces stress, and improves concentration by triggering the release of feel-good hormones such as dopamine, serotonin, oxytocin, and endorphins in your brain. The prolactin released after orgasm makes it easier to fall asleep. It helps alleviate menstrual cramps in women, while in men, it can increase white blood cells, which support the immune system. It also helps flush out harmful fluids that build up in the prostate, potentially reducing the risk of prostate cancer. The likelihood of conception with younger and healthier sperm increases, and the preservation of nitric oxide levels, which decrease with age, helps maintain sexual desire. And, of course, the best part, there is no risk of pregnancy or sexually transmitted diseases. It can also help you discover what types of stimulation you enjoy and share this with your partner. So, is there no harm in masturbation? Of course, there can be. As with everything, balance is key. Doing it too often or getting used to the same type of stimulation can prevent you from enjoying real sexual intercourse in the future. In particular, those who have a habit of masturbating by lying on their stomach and rubbing against a surface may experience sexual dysfunction over time. The habit of applying excessive pressure or using forceful methods, known as the death grip, can also make orgasm more difficult. Moreover, this is not just about hand strength. It can also be related to position, speed, toy use, or sticking to the same fantasies. In women, prolonged and repetitive use of certain stimulators can reduce sensitivity to natural stimuli. Going further, aggressive techniques can lead to serious physical issues. In rare but medically recognized cases, improper practices can cause severe trauma to genital tissues. Bending the penis while erect is particularly risky. Masturbation with insufficient erection can lead to micro-tears, plaque formation, and penile curvature. If you experience such issues, taking a break can help your body restore its natural balance. Trying new techniques, using lubricants, avoiding external stimuli like pornography, and exploring more natural methods may be beneficial. Seeking support from a sex therapist is also perfectly normal and healthy if needed. Before we continue, press the like button if you like the video and don't forget to subscribe and press the bell icon so you don't miss more videos like this one. So, how common do you think masturbation is in society? Studies conducted in 2010 and 2018 show that between 67% and 94% of men, and between 43% and 50% of women, 85% of women have experienced it at some point in their lives. So it's much more common than we think. Women generally engage in it less frequently than men. But this, of course, varies depending on individual preferences. When looking at age groups, individuals aged 18 to 24 stand out as the group that masturbates most frequently. The average age of onset is around 15. An interesting finding is that individuals with partners tend to masturbate more frequently than those without. While women mostly do it for reasons related to sexual satisfaction, the opposite can sometimes be observed in men. However, this is not true for everyone. Individual experiences can vary greatly. Now, Let's talk about the physiological functions of orgasm and some differences observed between women and men in this regard. First of all, there is a noticeable difference in duration. While orgasm in women can last an average of 20 seconds or longer, in men it usually lasts between 3 and 10 seconds. In terms of orgasm frequency, studies on heterosexual relationships show that approximately 95% of men and 69% of women experience orgasm. However, it is not only biological sex that affects these rates, but also sexual orientation and relationship dynamics. For example, according to some studies, lesbian women may have a higher frequency of orgasms compared to heterosexual women. This may be related to factors such as relationship duration and mutual communication. After orgasm, both women and men release a hormone called prolactin in the brain, which supports relaxation and the transition to sleep. An interesting fact: women can experience orgasms in their sleep, just like men. According to research, approximately 37% of women have experienced this at least once in their lives. This is one of the lesser-known but completely natural functions of the human body. Now, let's debunk some common myths about masturbation. Statements such as, masturbation causes blindness, or it causes hair to grow on the palms, are completely false. There is no scientific basis for them. Such myths, which usually stem from religious or cultural beliefs, do not reflect the truth. The idea that masturbation causes erectile dysfunction is also incorrect. On the contrary, it can improve orgasm quality by exercising the pelvic floor muscles. The view that masturbation reduces sensitivity may be partially true, as the body can become accustomed to a certain type of stimulation over time. However, this can be prevented by trying different techniques or using stimulation similar to sexual intercourse. The statement, masturbating every day is harmful, is also generally incorrect. Daily masturbation is considered normal as long as it does not negatively affect a person's life. However, if it becomes an obsession, interferes with daily life, or causes avoidance of intimacy with a partner, it should be considered a problem. The idea that masturbation is harmful for people in relationships is also incorrect. Masturbation, whether with a partner or alone, does not negatively affect a relationship. In fact, it can enrich sexual life. Finally, the myth that masturbation lowers testosterone is not supported by scientific evidence. Testosterone levels temporarily increase during orgasm, but return to normal afterward and do not lower overall levels. Despite being widely spread throughout history, this myth has been debunked by scientific data.